So this is where we get into the specific reasons why people make a switch.
So another verbatim, what would make you consider switching? We're looking at actual words that people typed on. Not getting the care I deserve came from a millennial, not surprisingly. That's just something that as they've grown up, they have been handed things. I'm a boomer. I handed it to my kids, so I understand it. But the other things, of course, that can make people consider switching: affordable care. More and more with those high deductibles again, we pay more out of our own pocket for our health care, so that's just really important. Obviously, insurance, like Mike's talked about, is a really important thing. But then we get right into like poor service, horrible staff. One person typed in, they should know that the care begins when I walk in the front door. But that's when I consider my care beginning. And so no matter who intersects with your patient in the hallways, on the elevator, at the desk, at the registration, on and on and on, that's where they consider their care beginning. Access, availability, they would switch for bad care, obviously a bad experience. And then we're going to have a whole bunch of doctors retiring coming up here. And with lots of our clients, they're struggling with hiring replacements and all of that. So if somebody's doctor retires, to really think hard about retaining that patient. And in fact, I think we just published a blog this week about that very thing. And then maybe they're looking for higher quality, but isn't it interesting how that's one of the lowest?
So this is where we get into the meat of actual change. So in the study, 30% of consumers say they've switched health systems in the past. So I think we feel like this is a really important number, that in your marketplace, if you extrapolate this across different markets, in general, 3 out of 10 people have switched the health system in the past. That's important, we feel, because we get into maybe a brand effort, a service line effort, as I mentioned before, any type of specific thing. We now ask our clients the question, okay, so what percentage of people are in play? As we start to set expectations for performance for this effort, how much of the market do we feel like we can affect? So we believe that 30% on average is in play based on past behavior. Unfortunately, it is typically negative experiences that drive change, whether it's service or quality of care or cost. But this is a big driver. You see the difference that negative experiences are almost 20 points higher than positive experiences. We like to think that positive and maybe marketing or communicating the positive attributes or benefits of the system, your values, the service line, specialization are going to be great drivers for change. But only 19% of people that have switched actually switched because of expectation of better care somewhere else, all on its own. And then, roughly about 42% feel that they've changed because of things outside of your control. So insurance, if they switch insurance and you are not in network with a health system, maybe it's a competitive environment in your marketplace and you are in network, your competition is not, vice versa. Unfortunately, it's a driver. Location, they move, you become inconvenient for them for some reason, or when your doctor retires or moves, that becomes an issue for change. On the negative side, unfortunately, and I'm sure you deal with this every day, service issues are at every point of contact. It's things like we ask the question, why did you decide to leave? These are the sort of verbatim answers that they gave. And I'm sure that they resonate with you. Perhaps they're even the bane of your existence. But these are the things that move people more actively than passively. And here's where we get into the actual behavior versus anxiety. So in the presentation, we kind of go through it one by one. And I'm going to ask Marsha to kind of go through this and show both. Yeah. And so here, a couple of things. You see that anxiety generally outweighs by a pretty significant margin their actual behavior. So in the second item here, my insurance coverage changed. 66% of people say that they have anxiety about that. But only 21% of people said that they've actually made a change based on that. So I think, this is a difficult one to say because we deal with it in a couple of scenarios today. It's a difficult one to say, hey, don't worry about insurance. The anxiety is, 40 points higher than the actual behavior. But because I think it's different to every situation, but it is something to really pay attention to. Things like you start to get into lack of compassion and kindness. People are concerned about that. I mean, that part is on their mind. But again, only 26% of people would say that they've switched because of a lack of compassion.
But I would just comment that it's closer that in that regard with 26 to 51 if you didn't treat them with compassion and kindness than if their insurance changed.
Yeah.
And so, yeah.
Also, we've got a little sidebar that millennials are much more likely to say compassion and care cause them to switch. So here it is 26%. For millennials, it's 36%. And I think that item just came up on your screen.
There we go.
The next slide is really narrowing down even more. So today, this is an important statistic. Today, 14% of people are thinking about switching. We think that this is a really important number when you consider your efforts on a day-to-day basis. 14% are in play today. They're thinking about it. They're actively thinking about it. A lot of times when we discuss this, either internally or with clients, we equate this to like your checking account. So how many of you have ever switched checking accounts? Banks are out there marketing all the time, and generally there's in our experience, there's a great complacency with people who would ever think about changing their checking accounts. They probably don't even like their bank, but the hassle of changing their checking account far exceeds the satisfaction they have with their current institution. So when we look at something like this, we're trying to determine, all right, how much of the market is actually listening and how much of the market can we actually affect today. So 30% have changed providers in the past. Half that today are thinking about their healthcare scenario today.
We were really surprised, frankly shocked at this number. And as we think about adding 14% to your market share would be significant to say the least.
Yeah, it seems like a small number on paper, but 14% growth, or heck, pick between 7 and 14% would be significant growth. So this next statistic about change: 21% have gone outside their preferred provided for treatment, and 32% would consider for future needs. The limiting factors in this obviously are insurance. Although, again, millennials in another part of this study feel they have greater choice. They don't feel as restricted by insurance. They feel empowered to make their own decision and go outside of their in-network issues.
So just to reiterate, why did you decide to leave your current provider? Highly disorganized office with outrageously excessive wait times. One thing I think that we can all learn from the compassionate care and service issues is that as you work with every single staff member in your organization, no matter what position they hold, they have huge impact on patient experience. And so if you're a janitor, if you're in a dietary department, if you're cleaning the room, whoever you are, every intersection you make can make a huge difference in retaining patients.